You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. Today's a special edition, and we're going to take you through the process today. And with us, we have probably the busiest implant dentist in all of San Diego. With us, we have we've had him on the program before, Dr. Christopher Henninger. Dr. Henninger, welcome back to the program.
Thank you.
Now, you brought a stack of photos.
I did. I'm super excited about it.
And when did you started, I interviewed you, what, like 10 years ago?
Yeah, I think we've done 4 or 5 versions of this show, and the first one was about 10 years ago, yeah.
What's changed, like in 10 years, for people, like what's changed in implant dentistry?
Yeah, so I was thinking on the way here, you know, how we did it 10 years ago and how we do it now. And the workflow is entirely different. We were in an analog world back then, and now...
What do you mean? What do you mean?
So we were taking GUI impressions, and there were a lot more visits back then. And now we're in a totally digital workflow, and we're leveraging technology like we haven't been able to do before. And the reason I like that is because, for 2 reasons. It makes it more comfortable for patients, and it makes the workflow a lot quicker.
So workflow, and I asked you in the green room, I said, how many visits in a perfect world can you get somebody with an upper and lower set of teeth that don't come out? You said 2 visits.
Yeah. So
really?
Yeah, and we're not including the visit, the consult visit in that.
Okay.
So the most important visit to me is us getting to know each other. I'm really passionate about knowing where people are coming from so that I can serve them in the best way possible. And everybody really has a story about, you know, how they got to where they are, and you know why their life isn't the way they want it to be. And I'm really interested in that story, because if I can get that out of people, I feel like we can work towards a goal of who you want to be.
What do they like more, the way it looks or what they can eat?
And that's the thing about this. It's different for everybody. You know, some people, you know, they have trouble with the way they look. Some people, they're hiding the fact that they can't eat. I have a really good story about a patient who I always think about her when I come on the show, because she told me, she's like, she really liked going out to eat with, you know, her friends and her family, but she couldn't eat. Like, she literally couldn't eat. She was that disabled. And so she would remove herself from the eating part of going out to eat. Like, she would literally go out to her car, you know, and eat, and then come back for the sociability of it. And I mean, that just changed my life forever, because she was altering her lifestyle, and not the best person that she wanted to be, you know, just because she couldn't eat. And to get her back into a position to where she could eat and do what she wanted to do was life-changing for her. But some people, it's just being able to eat. Like my grandfather, we've talked about him before. You know, that guy loves eating more than breathing.
Okay.
And getting him back to eating was really important to him. But just like my friend who couldn't go to restaurants anymore, she just didn't want to look the way she looked, and changing her appearance was really important to her. You brought up your dad. What was important to him? Playing the trumpet.
He wanted to play the trumpet.
Right?
So, I mean, he wore a denture for 40 years and was very resistant.
Yeah.
And now he has upper and lower teeth that don't come out.
So he experienced a unique transition, because he went from traditional dentures to snap-in dentures, and that made his life a lot better. He was able to play his trumpet the way he wanted to with his snap-in dentures, because the teeth didn't move around. They were attached to him. But when we changed him from snap-in teeth to permanent teeth, all he cared about was, could he still play his trumpet? And we've talked about this story before, and it makes us both laugh, but you know, the final try-in for his teeth, if you'll remember, I said, Joe, go get your trumpet. I want to make sure you can do what you need to do with your trumpet.
I remember that. That's
and he was
right.
like, I forgot it. I'm like, Joe, you forgot your trumpet? And he's like, I got to go back and get it. I'm like, Joe, you live 30, 40 miles from my office. Like, that's going to take over an hour or so. And he's like, no, I have to.
So he drove there. It takes him an hour and 15 minutes to get there.
Yes.
Back and forth.
He came back, and he made sure that with the prototype teeth that we had put in his mouth, that he could play his notes. Like, I think he even had a lesson that day. Yeah. And that he was teaching somebody. And he just wanted to make sure he could play his trumpet.
That's nice.
That was his, you know, I call it personal motivator. Like, I really want to know what people's personal motivator is, so that I can help them be the best version of themselves.
Are you ever on a consult and people have their hard luck story, you know? Do you ever get excited, like you're going, boy, they just think it's new teeth?
Yeah.
It's more than that.
So some of my assistants have been with me about 10 years, like as long as we've been doing this show. And the way I have it set up, that I like to meet people. I like to have my assistant and then the patient and myself kind of all in a row talking as a group. And sometimes when we hear these stories, my assistant and I will lock eyes and just know that this is a person that we can help.
Like, this is gonna be good.
Yeah, this is gonna be really good. This is a story. We know where the story starts. We know where it ends, even though the patient doesn't know where it ends. And we just kind of get this tickle in our belly, about how we can, help this person.
And look, at the top of the show, I said you're one of the busiest, most experienced guys in San Diego, probably one of the most, experienced guys here in California. So 2 visits. Somebody watching this, they're 2 to 3 visits away from getting a brand new upper and lower set of teeth.
Yeah, we do. After I meet you and we realize that we're a good fit for each other, and I can help you with what you need. I do want to make sure that I can help you with what you need, because if you need something I can't do, I want to make sure you get in a place where you can get what you need. I do teeth. That's all I do. I'm in the business of making people healthier, but the way we achieve that is through a healthier mouth. I only treat people that need dental implants. And my patients they come in probably 3 different categories. People who are just missing 1 or 2 teeth and just need something replaced. And I still do fix people's teeth, but it's kind of like the smile makeover type stuff. I don't do general dentistry anymore.
You have another dentist in the office that does those kind of things.
Yeah.
So you just focus on implants.
Yeah. So we do single tooth replacements, and then we help people with loose fitting dentures. So by adding implants to a loose-fitting denture, it stabilizes the denture becomes attached to the patient, and it doesn't move around anymore. And that's a life-changing thing for a denture wearer. And then I'm really looking for people who are sort of in this broken state that just don't know what to do with their mouths.
And you say even with bad gums, like really bad gums, you could do this.
Yeah. So this last patient that I meet very frequently, that typically will see our show, they've lost faith in going to the dentist. And typical dental experiences, you go every 6 months to have your teeth cleaned, and some people have bad gums, like you talked about, and they need gum surgery and gum treatment, root canals, crowns, things like that. And their experiences with the dentist have been, they've come in, they're told what's wrong with them, and here's how to fix it. And it's generally not a pleasant experience, and people do it because they have to do it. But the people I'm meeting have gotten tired of that system, and they don't know what to do anymore.
Nice.
And so they've kind of dropped out of going to the dentist on a regular basis, and really, like we talk about this a lot, they've lost hope in dentistry. And what this show over the years has done for my office is let people know that there is still hope. Like, no matter where you're coming from, I guarantee you there's hope.
That's nice.
We've been able, and I'm so excited about like showing some of my.
I know you have a stack of photos, so
Yeah.
we'll make sure to get to as many of those as possible.
But these were people who didn't know what to do with their mouths, and they were some of my extreme situations that thought there was no hope for them except to extract their teeth, and by gosh, some of these people were going to do anything to stay out of dentures. They just wouldn't go there, and we're able. I never say no is one of my life mantras, and I don't like people telling me no, and I don't like saying no to people, and so I'm about finding a way. I'll start with one of my patients.
All right, here we go.
Sorry, this guy, he's a military veteran, and he got to a point to where he had this he had this denture thing that he would put over his bad teeth so that he could go out, and he couldn't really eat with them, but they covered up his bad teeth. And he had a few more teeth break, and he's like, I just can't do this anymore. I don't have any way of covering this up anymore. And he's like, I need your help. He's like, I saw your show, and I believe you can help me.
All right.
And this guy had some really bad health issues, diabetes.
So his option was a denture.
I mean, that's all he thought his options were.
Okay.
But he ended up in permanent teeth.
Let's take a look.
And my favorite part about this guy, he lost 30 pounds in the process, and he is off.
Just eating properly?
Yes, getting him back to eating properly and having the confidence to eat the right things. He lost 30, 40, 50 pounds, something crazy like that. And he is off most of his medications. He had some liver issues that, honestly, he thought he was going to die from. And he thought he was going to die from his liver issues. And he's not even taking medication for that anymore. He lost so much weight. He got the infections out of his mouth.
Let's take a look at that.
Yeah. So his name's Frank, and I mean, honest to God, he's one of my most favorite patients from recently because of the transformation in his mouth. If you look at him, his pictures beforehand and his pictures afterwards, not only because of the teeth, but because of how healthy he is now, he doesn't look like the same person.
Is that right?
Yeah, it's quite amazing. And the nice thing about all of these patients that we're going to get to talk about today is they still come see me on a regular basis, and they come because they want to, not because they have to.
Good.
And
so let's go through these photos.
Yeah.
And sorry to interrupt, and we're going to rush you a little bit because you have a stack of photos.
Yeah. Again, and these are very near and dear people to my heart. And we were working beforehand. I was like, I want to use some of the old ones because they truly are my favorite people, and they still come see me on a regular basis.
Okay.
And they know coming to see us, it's sort of like a blessing now. We get to tell stories about the past, and I get to hear about what's going on in their life and what they can do now that they couldn't do before. So it's a lot of back and forth and just being friends. One of my favorite patients is Peter, and Peter, what I like most about him is like he's my age, and when I met him, I kind of saw myself in him. And he was born with a cleft lip and palate, so he was born with a problem, and he also had terrible teeth when I met him. And I personally think the reason that he got to where he got with his teeth was because he had so many surgeries on repairing his mouth.
Just had enough.
Yeah, he just didn't want anybody in his mouth anymore.
Okay.
Like he was just traumatized by it as a kid, and so he let his teeth go, and I mean they were literally like rotting out of his mouth. And a very complex case because of his, the deformity from the cleft. And we were able to get this guy into a position, and he had no job.
He looks good.
I know he was living off his parents, living at home at age 40, and getting this guy into a position to where he could be a productive member of society, get a job, live on his own. Like, it was really important to me to help this guy make a comeback. And so he's just one of my favorites. Just because I empathize and I identified with, who he was and who he could be. And so, yeah, he's one of my favorites. This is Sarah, and
right.
She was married and got a divorce. Again, I'm not trying to pick out like my friends or anything like this, but she just got to the point where she couldn't take care of herself because of some circumstances that were going on in her life, and that's what she looked like. Those were her teeth ahead of time, and she had broken a few, and she just got to a point to where I have to do something. And again, she was in a point in her life where she couldn't take care of herself, and her dad had stepped in to take care of her.
Okay.
And I was truly humbled by like her father stepping in and saving her. And part of saving her was getting her teeth again. And she had an eating disorder. She weighed 68 pounds when I met her. Wow. Yeah, she had a very severe eating disorder, and her father had helped her come back from that, and now she needed teeth again. And so these are her final teeth. I mean, she just turned out.
That's pretty teeth.
And
those are supported by implants.
Yes, she has I think 5 or 6 implants on the top, 5 or 6 implants on the bottom, and those are permanent.
So brand new upper and lower teeth.
Yes, those teeth are permanent. They don't come out of her mouth.
She looks great.
Yeah, and again, just like Frank, she made a dramatic change in her overall health. She was up to 120 pounds, so she almost doubled her weight while she was in treatment with us. And I was just so proud of her, like being able to like beat the eating disorder and get her life back. And I'll tell you what, she came into the office the other day for one of her visits with us, and she said, "I'm moving." I was like, "No, you can't. I don't want this to go bad. I mean, you've made a big comeback." She's like,
"Are they going to maintain with you?"
Yes.
Is that right? Okay.
Yeah, and that's a big part of what we do in our office is help you learn how to take better care of your teeth. So this guy also, he's a veteran, and we do a special thing for veterans every year. And this is again a guy that I'm very passionate about because I'm a veteran and he is a veteran, so we had a connection there.
So a guy with teeth this bad, he can't eat?
He completely worn down his teeth. This guy. He had literally worn them out.
So it's like you really can't eat like this.
Yeah, no,
not very well at all.
No, he was a Marine, and you can imagine that was one of his passions.
You're laughing because you know the end result?
Yeah, I mean, these people come, and I'm like, it's hard for me to articulate the fact that I've been through this a bunch of times with people.
Good.
And I know how this can work for you, and But I mean, look at how he turned out. I mean, he's just,
Wow.
yeah.
That's
He's driving for Amazon now, and he's just a guy that his personality change was one of the ones that really stands out for me, because I mean, really fun guy. Like he makes you smile when you talk to him. He tells jokes, and like he's just an upbeat person. But when I met him, he was one of these people that, you know, when he smiled, he didn't smile.
like you read him wrong in a way? Like you thought he was one way and then found out he was another way?
I thought he was a miserable individual.
Okay.
Like I really did. I thought somebody had done something terrible to this guy, because he was just angry and not happy. And again, he's one of my favorite people that come to the offices and just see us on a regular basis now.
That's
because,
nice.
and again, he's like your happy-go-lucky Amazon delivery guy now. He's fantastic. So this is another really good one. This is Regina, and she came to us looking like this.
That's an upper denture?
That's an upper denture, and she had like a temporary partial on the bottom. And I was like, no, you can't really be living like this. Like, there's no way. And
Did they come in skeptical? Sorry to interrupt, but I mean, look, they've seen you on TV, or you know, they've been to your website, and they go, can I really do it? I mean, is that their thing? Like, they don't even believe that it's possible
yeah,
for them?
that's really what breaks my heart the most, is like these people, some of them are very hopeless. And if I could leave you with anything, is there's hope for almost anybody. And like, if there's hope for Regina, you know, we can work with almost anybody.
So I interrupted when you were telling me, so she has an upper denture, bottom teeth were really bad.
Yeah, her bottom teeth were literally rotting out of her mouth, and she had a temporary partial that was just not fitting anymore. And she's like, "What? You know, is there hope for me?" Okay. Literally is what she said, and I said, "Yes, we can help you. We can make your life better for sure." And I really like giving people options, because I don't know where people are coming from.
Yeah. Okay.
And you know, and that's why I try to get to know you. I can give you my advice on what's the best thing out there. But if that doesn't fit in your budget, I want to make sure we find something that does fit in your budget. And that's why we still do snap-in dentures, and you know, as little as 2 implants, we can stabilize.
So her option would have been an upper and lower denture.
Yeah, I think
those. Let me see that after.
Yeah, I think that's what she thought she was faced with, was a lower upper and lower denture, and so you know, that's a really good shot of her, and this is another really good shot of her.
Good looking teeth.
Yeah, again, permanent teeth. They don't come in and out. And you know, this is a lady that had to alter her lifestyle because of her teeth. Like, she couldn't do what she enjoyed most in life because of her teeth. And I just think that's like, I just think that's an unbelievable shame. You know, I think dentists kind of, not everybody does this kind of dentistry, Randy.
Yeah.
And I really do. If you can't tell by now, I really enjoy the transformations that we've been able to make for some of our patients. Typical general dentists do crowns and fillings and cleanings and things like that. They don't get a lot of hugs and a lot of, you know.
Like, this is the most rewarding kind of dentistry.
I personally get a lot of satisfaction out of doing this kind of dentistry.
How much is experience, and we're really short on time, but experience, okay? Mm-hmm. How important, because a lot of people doing dental implants now.
Yeah.
You see them all over TV, you see ads online. Experience. Why is it so important?
Randy, experience is in doing the dentistry is one of the most important parts of this. 10 years ago, when we first started doing this dentistry, we've come a long way, and the technology is a huge piece in doing this. Getting from start to finish in 2 or 3 visits, it takes...
It's almost unheard of, by the way.
Yeah, and it is a small miracle, but it takes a lot of experience and technology to be able to do that.
When did you get your rhythm? After 5 years, you think?
I don't know. We've done a lot of cases. We've done probably 1,000 arches, I think, by now, and I think I made the shift when I started worrying less about the dentistry and more about, is this the right patient for us?
That's nice. Okay, good.
And so there's 2 things that are really important to me: is, can we meet the need of, you know, whatever your need is? And the answer is always yes, we can find a way to do that. But it's more important to me that you're comfortable in our office. If you're there's not many offices that do this and do it right, but I want you to be comfortable and you need to be comfortable in our office for this to be successful. So it's really important that you talked about doing this, and and skipping the consult and things like that. That's why the consult's really important for me, is so that I can get to know you and you can get to know us too, and make sure you're comfortable here. This is going to be a life-changing thing for you. And I want you to be comfortable with the people you're working with, and I want you to be comfortable that we have the technology to get it right.
Very nice.
And
very nice.
We have a lot of experience in doing this. I'm not perfect every time though, but I will guarantee you that we will get this right for you. And if we have some hiccups along the way, chances are it's not the first time that I've seen.
You're going to work with you. Good, good.
I've seen
now, I know you have 3 more photos left.
Yeah.
So if you can do each one in about 20 seconds, we can fit them in.
So this patient is also really important to me because I try not to use my friends, but she's her sister I went to college with, and her dentist told her she was going to be stuck in dentures at I think she was 28 when she came to me, and I was like, no, you're not getting dentures. This is not right for you. And what her story is that not only was this impacting her life, like she as a 28-year-old couldn't do what she wanted to do, but she had 3 kids just like I did, 3 young kids.
Okay.
And we go to the park, we go to soccer practice, we go to violin practice. Her kids were missing out. This is really important. Her kids were missing out because of the disability that was going on in her mouth.
Because she could never smile.
Right. And she didn't even want to go out. Like she'll be the first.
She was insecure about the appearance?
Correct.
Okay,
She'll be the first to tell you that my kids are suffering because of my teeth. It's okay that I'm suffering. Like, I'm tough. I can handle it. But she didn't want. What really, Sarah, her sister, brought her to me to help her fix was to help her be a better mother.
So she gets her teeth, and what happens?
Yeah. So she got permanent teeth on the bottom. We actually fixed her top, and I really believe that she today is the mother that she wants to be, not the mother that she had to be because her teeth were bad.
Good for you.
So again, that's a really important story to me. And then, this lady is always really funny because she's from Fallbrook and she lives on a peacock farm, and every time she comes in, she brings us peacock feathers, and that's like a really weird thing to have around the office. But her personality is just great, and she was one of the personalities that was hidden. The striking thing about me was, like, when I finally met her real personality after we got her teeth going, she's like bringing me peacock feathers. And this story just kind of nails it on the head. She brought me a Victoria's Secret bag. And I knew she was kind of a funny character.
Yeah.
And I was like, oh no, what is she going to do? Like, in front of all the patients and everything. And she's like, I brought you something for you and your wife in this Victoria's Secret bag. And everybody thought it was, some sort of lingerie or something crazy like that. And it was chocolate. So she just got a good kick out of seeing me sweat a little bit.
So no more dentures?
No, she had really bad gum disease, but she's in permanent teeth now. And again, she's the best version of herself.
Good.
That I think she could even
Last one
imagine.
over there.
Yeah, this guy, he's another good story because his profession was being altered by what was going on in his mouth. He's a musician.
Okay.
And he was getting to the point where he's actually kind of, he's a guitar player and he sings, and he plays like at the Belly Up and all these like really high-end venues here in San Diego. And he's like, look, I just can't do this anymore. My teeth are terrible. Like, it's affecting my performance, is what he told me. And so again, we did both him and his wife, honestly. And he's like, I can't do the snap-in denture option because I won't be able to sing with that. He's like in a rock band, really. Yeah. And so this is him afterwards. He wanted a white smile and he got it. And his thing is he's the rock star that he wants to be now. So
that's very nice.
Again, very nice man.
And we have to bring this up because we get questions about price all the time. Costs. Now we should mention, even the best dental insurance does not cover this. Maybe max pay out $1,000, $1,500. Medicaid for sure doesn't cover it. Medicare, you're able to you work with them, right?
Yes, we do.
And you'll try to get some money out of there.
Yes.
But you say people finance this.
Yeah, Randy, this is another important factor in getting people the treatment that they need, is finding a way to make this happen for people. Most of our patients, all of these people we talked about today, are of modest means. And this was really important to them, to get back being the best version of themselves, and so that they could be healthy again. And so we had to find a way to finance this for all of these patients. And so we do have some creative financial options in our office. I'm really proud of them, quite honestly, because I wouldn't get to tell you these stories about our patients if we didn't help with that side of things too. And so yes, we are one of the only Medicare certified providers. So if you have Medicare as one of your benefits, it's a little tricky with dentistry because they don't cover dentistry, but they do cover some medically necessary oral surgery.
Okay.
And some of this does fit into that category. So in order to know, you have to come in and let us take a look and see what you need and see what kind of coverages you have. But we do have some creative financing options.
Okay.
And there's something out there for everybody. I want you to hear that. I really do.
Good.
I don't pigeonhole people into something that they may or may not be able to afford. I like giving people options. I'm really passionate about giving people options, like in 3 different price points.
Oh, that's nice.
Yeah, it is. And so that you can make a decision that you're comfortable with. And I've done a lot of these cases, so I can help you. I can tell you the benefits and the pros and the cons of each option. And I enjoyed talking to people about that. But I have a team in place that is really good about how to figuring out how to fit this into your financial lifestyle. Again, you don't know what you don't know sometimes.
Everyone seems to, nobody says, I shouldn't have spent the money on that, right?
All of these patients would spend that money again if they knew, how they were going to be at the end.
So it's that big of a deal.
Yeah, and I keep saying this, but I'm in the business of making you the best version of you.
Could you address this? Because you say most of these people saw you on TV and they waited years in many cases. What's something they ask on every consult after they've seen the interview, but they're still skeptical? Maybe you could answer that question right now.
Yeah, so some people do think it's too late, or they're not a candidate, or they've waited too long. And it is true, the longer you wait, the harder the case becomes. And sometimes also the more costly it becomes. But I would encourage you just not to wait. There's knowing is half the battle. And just come and meet us and figure out what your options are. If saving your teeth is an option for you, believe me, there's nothing better
than what you do.
Yeah, there's nothing better than what God gave you. And if we can save your teeth, like Lauren, we saved half of her teeth. I think it's important that we try to do that.
Good for you. Excellent. And so what's the best way? They go to your website, make an appointment, or they just call your office and make an appointment?
It's best if you call the office. Okay. Again, I have people that want to get to know you, and I want to get to know you, and over the phone is the best way to do that. You can find out some information about our office that you could see on our website. I think that's a good place to get started. You'll find out if we do the dentistry that you're interested in. But give us a call. I'd love to sit down with you, and I meet a lot of hopeless people, and there's hope out there. There's a way to.
So they feel there's no hope.
Yeah, and that's the part that really breaks my heart, really, is I do meet a lot of hopeless people. And, I feel like my job is to give people hope, again, about having a healthier mouth.
All right.
And, whether it be the trumpet, whether it be eating, whether it be smiling, like those are things that I want to get you back to being.
Okay, good. I want to thank you for coming on the show. Yeah. Great stuff, Dr. Henninger.
Appreciate it.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.